I am just presenting for the presenting sake. I enjoy presenting the free paper because it is the hard work which we try to communicate. And I'll be talking on histopathology, immunohistochemistry, molecular biologic study in eviscerated and nucleated specimen of end-stage ocular inflammatory disease, which often we think are useless, and the patient feels that no information can be gathered. Several inflammatory diseases can be recalcitrant to treatment. Some of such eyes can be painful and blind and requires enucleation or evisceration. Histopathology, immunohistochemistry, and molecular biology study can be done in such cases and can unravel many mysteries. We describe the histopathology, immunohistochemistry. We describe the histopathology, immunohistochemistry, and molecular biologic study, and a retrospective chart analysis is a 18 eviscerated or enucleated globes secondary to the intractable ocular inflammation over a period of 10 years we collected, and we did that study. I will discuss each case scenario independently in subsequent slides. First is the tubercular uveitis. 42-year-old man, old woman, dimness of vision in the right eye for 50 days, developed exudative mass near the macula. Her raised serum ACE and positive coem test indicated possible sarcoidosis. She was treated therefore with high dose of oral steroid elsewhere, developed multiple subretinal abscess. Eye could not be salvaged and has to be eviscerated. And this is the photograph of the fundus showing subretinal abscess. Those times that montage photography was not there, and we could see the eviscerated specimens, the multiple acid fast bacilli, myriads of acid fast bacilli. These are 3 cases of tubercular pan-uveitis. We could find the Mycobacterium tuberculosis genome, which is detected by a newer technique nested in real-time PCR. Acid fast bacilli was seen only one case of TB pan-uveitis. So most of the times it is a paucibacillary in nature, and you can see that caseation necrosis and PCR positivity of Mycobacterium tuberculosis. This is a rare scenario wherein the eyeball is a tissue itself, you can get that via organisms and the molecular biologic evidence. This is a patient, very interesting, tubercular sclerouveitis, masquerades as an ocular tumor. Eye was removed thinking that it is a tumor when histopathology showed chronic inflammation, and there is a PCR positive for Mycobacterium tuberculosis. This is a patient of a very interesting case. We don't get this type of cases. Pars planitis, and you can see the pars plana membrane over there, and we did the immunohistochemistry and histopathologic study. We could see the glial tissue proliferation, which was GFAP positive, and immunohistochemistry showed both the T cell and B cell marker positivity, indicating the combined immune reaction. Eels disease, we are fortunate to have a published histopathologic, immunohistochemical, and molecular biology study of enucleated specimen of Eels disease, and this patient had blind eye in one side, other eye has retinal vasculitis, it's capillary non-perfusion. I begged the patient for the blind eye to get it removed, and this removed eye showed inflammation around the neovascular channel, and these inflammatory cells are CD8 positive, both CD3, CD8 and CD68 marker was positive, and interestingly CD8, that is the T helper cells, was positive. This is acute retinal necrosis. Here we not only found the inflammation in the peripheral retina, we would find the occlusion, occluded blood vessels, and the viral inclusion bodies could be seen over there. And there is a CD3 positivity on the immunohistochemistry was seen, indicating though there is an infection, there is an immune-mediated reaction plays an important role. And this nested PCR was positive for varicella zoster virus. This is a case of VKH, where usually we see the T cells, but we should see the B cell marker positivity in this case. Sympathetic ophthalmia, we can see the granulomatous inflammation and the typical diffuse inflammation of the choroid, and you can find as usual other reported CD3 positive with the T helper cell positivity. Tubercular scleritis in a patient with rheumatoid arthritis. This is a 52-year-old woman who has rheumatoid arthritis. We are thinking that is a autoimmune disease. We pumped her with steroid, immunosuppressive agents, even IVMP. Patient eye became painful and blind. The eye was enucleated. The patient died with a CNS tuberculosis, and we could find out this is a globe which got perforated from nodular scleritis, and we could find out that granulomatous reaction and PCR was positive for microarchæum tuberculosis. In summary, contralateral blind eye of the bilateral disease can provide valuable information on histopathology, immunohistochemistry, microbiology and molecular biology study. This can help in management of the other eye. Most importantly, this can unravel the mystery of various inflammatory disease pathogenesis. Thank you very much.